Hello and welcome to today's program, the Affordable Care Act Update, What Advocates and Cancer Survivors Need to Know, brought to you by the National Coalition for Cancer Survivorship. My name is Eric and it is my pleasure to be your moderator for today's session. For technical assistance, please send an email to canceradvocacy@compartners.com or send a message in the chat box. Today's program is scheduled for 60 minutes and includes a question and answer segment. Please note that today's session is being recorded and all participant lines will be muted during the session. If you need assistance at any time during the program, please select *0 and the operator will assist you. And to interact with the presenters, you may submit a question at any time using the chat feature located on the lower left side of your screen. Please note your questions will not be viewable by other attendees, and these instructions will be repeated later in the program. Also, if you take a look at the left of your screen, you will notice the links area where you will find resources related to today's program. If you would like a copy of the presentation, please click Slide Presentation to open and print a copy of the slides. Now it is my pleasure to introduce today's first speaker, Shelley Fulnasso, CEO of NCCS. Shelley, welcome to the program. Please begin.
Thank you, Eric, and thanks to everyone for joining us today. We are thrilled to have you all as part of the webinar today. This is a program of our Cancer Policy and Advocacy Team, or CPAT, and we've had an overwhelming response to the webinar today, and we're thrilled that you could join us. Clearly, there's a lot of interest and really concern about this topic. I'm going to give you a little preview right now. We don't have all the answers yet because we don't know what's going to happen here in Washington, D.C. as the Congress and the new administration discuss repealing and replacing the Affordable Care Act, which is what they campaigned on, and they do feel an obligation to fulfill that promise, but we really don't know exactly what's going to happen. But it's really important that you all have an understanding of what's going on, and we're going to give you the background as best we can, both for you as advocates and as cancer survivors and friends of survivors. And we're going to give you some information that you can use going forward to help advocate. It's clear that there has been a groundswell of support for the Affordable Care Act in the last couple of months, and that has made a difference on how Congress is thinking about this and the timelines, because initially they said they just wanted to repeal it and then they would figure out a replacement, and now there's much more talk of repealing and replacing together. And I don't want to steal Lindsay's thunder, but my point in saying that is just that it's making a difference when members of Congress hear from their constituents. So we want to give you the background today and some tools so that you can do that, and we'll be here to support you. So now I'm going to turn it over to our speakers. First, we have Lindsay Houff, who joined NCCS in November as our public policy manager. And in the short amount of time she's been here, she's done a great job working on these issues. She's been talking with a lot of different members of Congress's staff members and offices about their plans, and she's going to share with you some background information on what's going on and what she's hearing. And then she's going to turn it over to Monica Bryant, who is an attorney and the Chief Operating Officer of Triage Cancer, and she's a wealth of knowledge about legal issues for cancer survivors and insurance issues, and she's going to share with you some background on some of the provisions and also what you as a cancer survivor, for those of you who are survivors, need to know. So I will turn it over to Lindsay now.
Thank you, Shelley. Hi, everyone. Thank you again for joining us today. I'm going to be giving an overview of the Affordable Care Act and where the law stands now, just to set the stage for our discussion on what this all means for cancer survivors. So in 2010, Congress passed the Patient Protection and Affordable Care Act. And like everything else in D.C., it has to have a catchy name or an acronym, so it's also referred to as the ACA or Obamacare. The ACA reformed the healthcare system and increased the number of people with health insurance coverage by about 20 million individuals. And it did this by overhauling the individual insurance market, where people generally buy their own policies, and by expanding Medicaid, which is a public program that covers low-income Americans. The ACA created the exchanges, where you can shop for insurance and those with lower incomes can get assistance from the government to help pay for their health plans. One of the most controversial pieces of the ACA is the individual mandate, and that requires that everyone buys insurance or pays a penalty. The mandate exists to encourage people who are unlikely to buy coverage, mostly healthy people, to sign up. And many health economists believe that the mandate keeps the premiums low overall. One of the most important provisions of the ACA that helps protect cancer patients and survivors is the protection against exclusions due to pre-existing conditions. So before the ACA, an insurance company could actually deny coverage to an individual with a pre-existing condition such as cancer, or even if they did provide coverage, they could charge an outrageous amount for it. And the ACA put a stop to that. Along those lines, the ACA also provides protections against lifetime and annual health care spending caps, and it limits out-of-pocket maximums, which is the maximum amount of cost for covered services that you have to pay out-of-pocket for. The law also lets young adults stay on their parents' insurance until the age of 26, and it requires health care plans to cover 10 basic categories of medical services, and they call these the essential health benefits. And this includes things like trips to the hospital, prescription drugs, and mental health care. The essential health benefits actually protect all Americans, so even if you're enrolled in health insurance through your employer and you're not on Obamacare, you're still protected by all of these provisions. As you likely know, one of the biggest criticisms of the ACA is that it's not affordable. In some of the areas in the U.S. where premiums have spiked, this is true, but it's not necessarily true across the board. There are many areas in the country where premiums have actually decreased. And even before the ACA, premiums increased by about 10% each year. The Congressional Budget Office, or the CBO, recently estimated that if the ACA is repealed, there could be up to 18 million individuals uninsured, and that could cause premiums to rise up to 25%. That CBO analysis was spurred, of course, by the action Republicans in Congress took earlier this month to repeal the ACA. Through the budget reconciliation process, congressional Republicans are expected to repeal the ACA in the coming weeks. But it's still uncertain as to what will actually be the replacement. There are a few possible strategies that Republicans may take in the repeal process. They could repeal the law and simultaneously replace it with their own plan. They could repeal the law and delay replacing to a later date, which would definitely have a negative impact on the health insurance market and could leave people without health care. They could also, as the newest replacement option released earlier this week by Senators Cassidy and Collins does, they could keep the ACA for states that want to retain the law. But this option is not ideal as it relies heavily on health savings accounts and high-risk pools, and we know that those don't provide acceptable coverage, and it's not economical for individuals and is not economical for the U.S. There are a few replacement plans floating around, as you've heard, and none of them have provisions, but all of them have provisions that could be harmful to cancer survivors, and the possible replacement plans that have been presented overall are inferior to the coverage that the ACA currently provides. NCCS will continue to meet with legislators and their staff to monitor the process, and we'll discuss later in the webinar how you can take action now to make sure that cancer survivors have access to quality and affordable health care coverage. So now that we've set the stage for where we are with the ACA, Monica from Triage Cancer will discuss what this all means for cancer survivors, and then we can talk about what we're going to do going forward.
Thanks so much, Lindsay. So this slide shows just some of the consumer benefits that we have gained under the Affordable Care Act. And all of these things are things that we are at risk of losing if the law is repealed. And so Lindsay covered some of these, and I'll go into more detail in a moment. But I think it was worth laying them all out in one place to really try to start to show the true impact of repealing the ACA. I mean, it's so easy for congressional leaders to say in a stump speech, oh, we're going to repeal and replace, but what does that actually mean? We're talking about losing some of these consumer benefits that have really started to become commonplace to many individuals. For example, the fact that insurance companies have to cover the routine costs of participating in clinical trials, or the fact that they can't deny coverage to or charge people more once they've had a cancer diagnosis. And this list is by no means exhaustive. We have to remember the law itself is thousands of pages, and we've now had over 6 years of state regulations and federal regulations and Supreme Court decisions. So all of these things are going to be affected, and there's a lot of moving parts here. So many people that I speak to across the country think that it's only people who need to buy a plan from the marketplace or the exchanges, as Lindsay talked about, or those individuals who have lower incomes and are receiving care through Medicaid would be affected if the ACA were repealed. But the reality is that everybody who has health insurance in this country is going to be impacted. So here we're seeing the 3 places that Americans get their health insurance coverage. So a vast number of Americans get their insurance through an employer, or they purchase insurance directly from a health insurance company, or they have care or coverage through one of the government programs like Medicare or Medicaid or Veterans Health. And the reality is that everything you're hearing in the news and even some of the stuff that I'm going to talk about today is speculation. And even if it's educated guesses, none of us have a crystal ball. And as I mentioned, there's lots of moving parts. So before I get into some more of the specifics, I just want to let people know that Triage Cancer has already posted several blogs at triagecancer.org that talk more about all of the details and what could change and how. And I know NCCS has some wonderful resources as well. So if you're interested in even more details after today's webinar, please feel free to check those resources out. So one of the major things that happened last week was that President Trump signed what's called an executive order requiring that there be a minimizing the economic burden of the Patient Protection and Affordable Care Act pending repeal. So what does that actually mean? What this does is it gives federal agencies like Health and Human Services or the IRS wide latitude to change, delay, or even waive certain provisions of the law that they deem to be overly costly for insurers, drug makers, doctors, patients, or states. So we're talking about things like just deciding that they're not going to enforce that individual mandate, which again is the requirement to purchase insurance or people pay a penalty. So you're effectively gutting a huge portion of the law. And there's still a lot of unknowns. It's unclear among legal scholars if the IRS could waive fines that the ACA imposed if people don't buy health insurance. So the President's Chief of Staff sent a memo to federal agency basically saying don't submit any regulations to be published in the Federal Register unless a Trump-selected agency approves them. But we haven't been able to find a list of all of those pending regulations. So again, still lots of unknowns. So even though this executive order creates some additional questions that we have, what is clear is that President Trump has no qualms about using executive orders to move the process of dismantling the Affordable Care Act along without congressional action. So let's get into the specifics of how people are going to be impacted. As I've mentioned, the repeal of the ACA has a potential impact on everybody. So what does it mean for people who have insurance through their employers? If the law would be repealed, it would mean that large employers would no longer be required to provide coverage to their employers. The cap on waiting periods would be eliminated. So this rule was imposed by the Affordable Care Act, and it said that employers cannot impose a waiting period longer than 90 days for new employers to be eligible for benefits like health insurance. So it's very commonplace for employers to say you have to work for us for X amount of time before you're eligible for benefits. The ACA said that waiting period can't be longer than 90 days. So again, really sort of making sure that people have access to coverage. With a repeal, there would be a reinstatement of lifetime or annual limits. meaning that once somebody's care reached a certain dollar amount, the insurance companies can just stop paying, and those people would be left effectively uninsured. There'd be no cap on out-of-pocket maximums anymore, meaning that people would have no way of knowing how much they would be responsible for paying if they were faced with a catastrophic illness. Before the Affordable Care Act, we know a huge percentage of individuals who were diagnosed with cancer ended up having to file bankruptcy even though they had insurance. And by placing caps on out-of-pocket maximums, we've greatly reduced that number. There would also be no requirement to cover preventative services. Thanks to the ACA, most people that were able to access preventative services for free, which means that they didn't have to hit deductible or copay for things like cancer screenings or other routine preventative services. The ACA were repealed, young adults could age out of their parents' policy earlier, meaning that the over 3 million young adults that gained coverage thanks to this provision would once again be left without affordable coverage. We'd have no coverage for routine costs of clinical trials, so insurance companies could go back to denying to cover claims for individuals who were enrolled in clinical trials. And we now have, again, potentially some limited access to external medical review if somebody was appealing their insurance company's denial of a claim. That's, again, another right that the Affordable Care Act gave us. So for people who now buy their insurance through the individual market, these are people who may work in jobs that don't offer health insurance or who are self-employed. We're talking about many of the same issues as those individuals who get their insurance through employers. But also, they could be denied purchasing insurance because they have a pre-existing condition. And we're not just talking about serious things like cancer. Prior to the Affordable Care Act, we saw denials based on a pre-existing condition for things like severe acne or high blood pressure. So it doesn't have to be something as catastrophic as cancer to qualify as a pre-existing condition. So we're talking about a lot of Americans here. And not only could somebody be denied, but they could also be charged more based on a number of factors, including health history, the fact that they're a woman, their age. All of those factors could increase their premiums drastically. And again, no caps on out-of-pocket maximums, which increases the likelihood for financial devastation if they're faced with a serious illness like cancer. We'd also have no limits on deductibles anymore, which means that plans could appear to be quite affordable, but they might have a very high deductible. So people would have to pay a large amount out of pocket before their insurance policy would start to pick up their share of the costs. Again, for these individuals who are buying plans directly from insurance companies, there would be no requirement for those policies to cover preventative services or the essential health benefits like prescription drugs or mental health services. And there would be no financial assistance to help people purchase health insurance in the individual market, which we've seen in the past, it places coverage out of reach for many individuals. So moving on to individuals with lower incomes, it's also a potentially pretty grim picture. So prior to January 1st of 2014, there were only 4 ways for somebody to access Medicaid coverage. You had to have a low income and a low asset level and fall into one of these 4 categories. For people coping with cancer, the way that they typically accessed Medicaid coverage was through the Age Blind Disabled program. However, what we saw in the community is a lot of times people ran into a problem that even though they were coping with cancer and couldn't work, and therefore had a low income, they usually had assets like a retirement account or a savings account, which would then make them ineligible for the Medicaid program. So they would have to spend down those assets to qualify, which again would end up pushing them into financial ruin. The ACA ended up creating a 4th door to access Medicaid, and this was for individuals who had incomes at or below 138% of the federal poverty level. So in dollar terms, we're talking about people making roughly $16,000 a year for an individual. With this new option, there's no asset test. It's just about income. When the law was written, the idea was that all of the states would have this new eligibility category. But the Supreme Court decision essentially made it voluntary for states, meaning that states had the option that if they were going to expand Medicaid coverage, they could. So right now, we have 32 states that have expanded and 19 who haven't. If the ACA is outright repealed, this option goes away. So again, we're going back to a situation where if you just have a low income, or if you have a low income and too many assets, like a retirement account, and get cancer, you may not be able to access Medicaid. So really, to sum it all up, if the ACA is simply repealed, it would really have a very significant negative impact on the cancer community. And namely, it would take away the ability for people with pre-existing conditions, like cancer, to be able to purchase affordable, quality health insurance. So it's not just about purchasing health insurance. It's about making sure that the health insurance that people can purchase is affordable and quality. It could also mean that we go back to the days where a cancer diagnosis equals financial devastation because of this inadequate health insurance coverage, with no out-of-pocket maximums, lifetime and annual limits, and the ability for insurance companies to rescind or cancel somebody's policy. So I certainly hate to be a doomsayer, and there is some potentially good news. President Trump has said that he, quote, likes the provision that allows for people with pre-existing conditions to purchase insurance and for young adults to stay on their parents' policy. He's also promised that, quote, we are going to have insurance for everybody, much less expensive and much better. Now, certainly, better coverage for less money would be wonderful. We're just not quite sure how that's going to happen, and we really haven't seen any proposals or details from folks that would do what the president has been promising. So with that, we're certainly in a waiting game, and this is not the last opportunity for you to get information. Things are changing on a pretty rapid basis. So in addition to the wonderful resources that NCCS has, I just want to remind you all that Triage Cancer has materials that may be useful, namely our educational blog, where we're trying to put out up-to-date information as things develop. And then additionally, our newsletter and website. Now, I would be remiss to not talk about the fact that we have to remember that change isn't swift. So we are continuing to operate within the system that we have now. And it's our responsibility to make sure that people have health insurance coverage for 2017. So for those of you on the call, if you do not have health insurance coverage yet, please remember that you can apply for Medicaid at any time, or you can still purchase a policy through the state health insurance marketplaces, or exchanges, same thing, until January 31st of 2017. So we're certainly coming up on the deadline, but we still have time to buy insurance. And what we've been hearing from a lot of people is, oh, the president's going to repeal the ACA, what's the point? And so we're unfortunately hearing a lot of people who just aren't making the effort to get health insurance, and I think that's a really dangerous thing because, again, change is slow. So for more information about how to choose a health insurance policy, including making choices between employer-sponsored options, we have a webinar on our website, triagecancer.org, that goes through all the steps about how to choose a health insurance policy. And if you aren't sure, you're completely starting from scratch, or you know people that could use some assistance, you can get personalized information on our recently released resource at cancerfinances.org. It asks you some questions, and we'll walk you through the various steps to let you know what your options are for health insurance. So again, if you leave with nothing today, please leave with the fact that we still have the ACA and we still have our current system. So if you don't have insurance, please make sure to enroll before the end of the month. And then I left our contact information if you have questions after the fact that aren't addressed here. So with that, I'm going to turn it back over to Lindsay.
Thanks so much, Monica. So I know that we just went over a lot of information, and the ACA and the repeal and replacement process is very complex. But we are working hard to monitor the process and to ensure that any replacement plan that is presented protects cancer survivors. So you probably saw in the news coverage from about 2 weekends ago the nationwide ACA rallies and the Save Our Care movement is growing. So we here at NCCS are constantly meeting with congressional offices and voicing our opposition to repealing the ACA and providing a patient perspective for any replacement plan that does come up. So now we're calling on you. We need your help to let Congress know that the ACA is important and should not be repealed. So we've created a living document that will be on our website, and it outlines how you can contact your members of Congress, and it includes a calling script, which we will be updating regularly as the repeal and replacement process evolves. So we hope that you will join us in fighting for quality and affordable health care for cancer survivors, and we're here to assist you in any way that we can. Our advocacy manager, who oversees our Cancer Policy Action Team, or CPAT team, is happy to help you and answer any questions you might have. And her contact information is on this slide, so don't hesitate to contact her. And if you're not already a member of CPAT and you're interested in joining, give Kelsey an email and we'll get you signed up. We always need more advocates to join us in this fight. So now I'm going to turn this back over to our moderator for the question and answer portion of our presentation.
Thank you. Again, we will now have our question and answer segment of the webcast. As a reminder, if you would like to ask a question, simply type your question into the chat box area located on the lower left corner of your screen. Once you have entered your question, click on the send button located next to the box. And as a reminder, your questions will not be viewable by other attendees. Shelley, we're ready for our first question.
Great. So the one question I'd like to pose, Monica, if you wouldn't mind addressing this, and it's really about the cost. So this question is from Meg. She said that I heard that the ACA cost to a family was pitched at $2,500 annually and played out at $5,600 annually. So we talked a little bit about, the cost being an issue in a lot of areas, and I know that that's a big argument for relief, that people need relief from the cost of it. So she said that Trump's statement is less expensive and much better. Can you address that, Monica?
I will certainly try. So obviously I don't know exactly what the details are with that, but what we have heard in the past is there's a lot of confusion about what insurance policies are actually going to cost somebody. And so what we typically advise people to do when they're trying to figure out the actual cost of a policy is to take the monthly premium, multiply it by 12, which gives them their annual, what they're going to pay for the year for their premiums, and then to add to that number the out-of-pocket maximum. And that's really what the policy is going to cost you if you are somebody who has a serious illness like cancer and will probably use so much medical care that you hit that out-of-pocket maximum. So what I suspect happened to this particular family was that they were pitched that it's going to cost you $2,500 for the year, which sounds incredibly low, but that would be great if that were the case. And what ended up happening was they ended up paying $5,600 out of pocket because that was the out-of-pocket maximum that they reached. So again, I need some more details to more accurately address that, but what I really recommend for people who are looking at policies and trying to figure out what it's going to cost them is take those monthly premiums, multiply it by 12 to get your annual cost, and add to it your out-of-pocket maximum. And in theory, that's the most that you're supposed to pay for the year if you're using in-network care. So I hope that addressed your question, Meg.
So I would also add that I think one of the issues is that the cost of premiums depends on the level of coverage, and as you said, not just out-of-pocket maximums, but what you're covered for. So you can get a low-cost plan that doesn't cover as much, or you can get a higher-cost plan that has better coverage. I think one of the issues is that the markets require sort of spreading the risk among a lot of people. And so there are certainly issues with if we change the market so that you don't have, so you're reducing the number of people covered, then you don't have the people to spread the risk over, and your costs could go up. So I think it's, I think everybody wants to see lower premiums, more affordable costs, but the problem is that a lot of the proposals right now wouldn't actually accomplish that. So they say that they would, but it's not clear that they actually will accomplish that. So I think that that's something that we're going to continue to monitor as specific plans come out. And as I mentioned before, that there hasn't been, the Republicans haven't coalesced around a specific plan. But there's definitely risk that some of these plans could actually increase costs if people leave the markets who are healthier and you have people in the markets who have higher costs, then the costs are spread among a smaller group of people and the premiums can go up. Okay, we have a lot of questions, and I'm trying to sort through them all, but one is that, Monica, I would love for you to address too, if you don't mind, is about, can you explain what HSAs are, health savings accounts are, and how might they be helpful or not helpful to cancer survivors?
Sure. So health savings accounts are literally accounts where money is deposited into an account, and then that money can be used to pay for health care. And they're only available to individuals who have a high deductible health insurance plan. So, in theory, it sounds like a good idea. But the problem is, once somebody has spent all of the money that's in their health savings account, then what? And so for individuals who have a serious illness like cancer, it can really leave them effectively uninsured and without access to affordable care or a way to pay for their care.
Thanks, Monica. So okay, here's a good question. We are running into more and more facilities no longer accepting ACA plans. What are patients supposed to do?
Do you want me to take that?
Yes, thank you.
Sure. So a couple of things that I want to say about this. There is still a huge amount of misunderstanding about the Affordable Care Act and about the marketplaces and about the plans that people are purchasing within the marketplaces. So when somebody goes to a state health insurance marketplace or healthcare.gov, what they are purchasing is a health insurance policy from a private health insurance company, like a Blue Cross Blue Shield or a Humana or an Aetna. So we hear from people that they said, oh, my doctor's office said they don't accept any Obamacare plans. Well, the reality is there's no such thing as an Obamacare plan because, again, you're purchasing plans from private health insurance companies. You're just doing it through the marketplace. And then we've also heard that once somebody goes to them and says, oh, no, I have the fill in the blank, Blue Cross Blue Shield PPO, the doctor's office says, oh, we take that. So again, part of this problem is there's still a lot of misunderstanding and confusion about what these marketplaces are all about. The other piece to this puzzle that people have to remember is that health insurance companies and healthcare providers have always had the ability to contract with each other and negotiate with each other what they are going to accept and what they aren't going to accept. So this is not something new post-Affordable Care Act. There's always been cases where a doctor has said, I'm no longer going to accept this particular health insurance policy. So again, what I would really urge people to do is make sure that they're using the correct verbiage. So don't say to your doctor, do you accept this Obamacare plan? Because again, lots of confusion. Do you accept, and then the name of the plan that you have would be a better way to ask the question. And then the other piece of this is, while you still have the ability, since we're still in open enrollment, is to make sure that whatever plan you're choosing, your providers will accept. And so you can do that in two different ways. If you go through healthcare.gov, there's actually a link that you can pull up to look if their providers accept the plan. I also recommend that you call the provider themselves and double check that they are going to continue accepting that plan. So as with anything else that we purchase, we have to be good consumers and do our due diligence when we're buying insurance.
Great. Thank you, Monica. So there's another question about what can we as individuals do beyond contacting our members of Congress? So I'll answer that question and then let Monica and Lindsay add anything if they would like. So you can call your members of Congress, and our tip sheet gives you the number and some points about how to do that. Please check back, because we're going to be updating that over time as the messaging may change. Right now, it's pretty general messaging about why this is important. But if we learn in the next week or two that there's a specific plan and we have more specific concerns with it, we might change that messaging. You can call often. You don't have to just call once and say, I've done my job. Now, I think it's also really important to meet with your members of Congress in the district, and they do come home most weekends. You can try to, and they have events, so you should sign up for your member of Congress's email newsletter, and you'll find out when they're doing town hall meetings, and you can try to attend those. And you can take the same tip sheet and the same messaging to that, or if you have additional questions about what you should say, you can get in touch with Kelsey. Please be respectful at those. We saw there were some reports of town hall meetings where people were shouting at their members of Congress. I don't recommend that as a good strategy. I think it's better to respectfully convey your concerns. But there were some town hall meetings where they expected a few people and got a large number of people talking about why this is really important to them, and that makes a difference. So the best way to find that out is to join your members' email newsletter. Now, the senators, especially if you live in a big state, it's going to be a little bit harder to do that, but your House of Representatives member will have meetings in the district on a regular basis. You can also follow them on Twitter and on Facebook. You can tweet to them, and you can share your story or share your perspective using a hashtag #ProtectOurCare. That is a hashtag that a lot of different consumer advocacy groups are using to try to amplify the message so that it's not just all these different groups working on it separately, but people are working together. So if you want to tweet and use the message, the hashtag #ProtectOurCare, and then tag your member of Congress in it. We did a webinar last fall on social media strategies, and we had some excellent speakers who are pros at social media who gave some tips on how to do that. So you can go back and check that out if you would like. You should also consider trying to reach out to your local media, especially if your local newspaper has a healthcare reporter who's done stories about this. They're looking for stories of individuals who are impacted by that. So you can contact that person directly. Usually their email is online on the website for the newspaper. You could also, message them through social media or follow them on Twitter. You could also write a letter to the editor or an op-ed for your local paper. Your members of Congress read the local paper, and their staff members read the local paper. So that's where you're going to get a really big impact, is on those local papers. You can also meet with the district staff of your member of Congress, even if you can't make it to a town hall meeting. They do relay what they're hearing in the district to their Washington, D.C. office. So you can ask to meet with them. But you have a better chance of meeting with a member, him or herself, if you meet in the district than if you come to Washington, because when they're here, they're in so many committee meetings. I think it's really important to share those stories of how people are going to be affected. I think it's also really important to share data and facts, but I think that's the kind of thing that we are sharing, and they want to hear from their constituents about the real personal stories. So there's a lot of different ways you can get your message out there using social media, and it's still, the point is to for your member of Congress to hear from you, because the groundswell of support is really making a difference. And I don't know that it's going to stop them from their effort to repeal, but at least if they understand that it's important that they put in a replacement plan that meets people's needs. I think that's going to be a big win if we can do that. Is there anything else, Monica or Lindsay, that you would add that people can do?
Just regardless of whether your members of Congress are Republicans or Democrats, it's really important to share your story with Democrats as well, because they, are going to be hopefully be part of the replacement process at some point, and we just want to make sure that the patient voice is part of that result.
Yeah, I mean, I think you guys definitely covered all of the important things. I would just say the other piece that might be useful is to be talking to your friends and family about all of this. So let them know that there are things that they can be doing. Even if they have never been touched by cancer, health insurance is important to all of us. So I think it's not just about us to our elected officials, but it's also us to our communities as well.
Right, and if you live in a blue state and think, well, my senators are on board with this, it's not as important. Well, send the tip sheet to your family members who live in other states where their voice is going to be really critical. The members of Congress who are, the Republicans who are really against. Who are for repeal, let's just say. Those are the ones who really need, not to be partisan, but those are the ones who really need to hear from you. So if that's not your district, then send it to your friends and family who live in those districts. Okay, so we're going to move on, and Monica read my mind because my next question I was going to address to her is high-risk pools. Can you just help us understand what they are, how they've worked in the past, and what are the concerns for cancer patients with high-risk pools as an alternative?
So high-risk pools are not a new idea at all. So in fact, more than, I think, 35 states had high-risk pools to try to help people with pre-existing conditions access health insurance coverage before the ACA became law. And certainly those high-risk pools were a lifeline for many people. To get coverage when they couldn't get it any other way, they were not a solution to the problem. If they were, we wouldn't have needed the Affordable Care Act. And one of the reasons is because they usually had a cap on the amount of coverage that they were able to provide. So for example, California had a $75,000 cap per year. And the reality is cancer care is also usually much more expensive than that, which left people in a situation where they had to pay out of pocket for any care over that with zero help. I mean, it was dollar for dollar. There were other situations where states had high-risk pools that had 6-month waiting periods for coverage if you had a pre-existing condition. And if somebody's diagnosed with cancer, a lot of times they can't wait 6 months in order to get coverage and get care. There were also situations where there were wait lists due to budget constraints. Some states closed their high-risk pools altogether or had really high deductibles and out-of-pocket costs. So it's one of those things that in theory it sounds like a fantastic idea, and if money grew on trees and we had unlimited budgets at the state level, they might be really useful. But the reality is it's one of those things that we tried and it didn't work. So, I fear that some of the news articles aren't really talking about the fact that this is not a new idea and that it didn't work for people who had serious illnesses like cancer.
Monica, I think you have the best line. If high-risk pools worked, we would not have needed the Affordable Care. I think that's absolutely right. It's a good talking point.
Yeah, it is.
Someone write that down.
We did.
We did. We wrote that down here. And, there's a lot of people have talked about that the Affordable Care Act is, was a successful policy that had really bad marketing and the politics aren't good. And I know you all at Triage Cancer have really spent a lot of time educating people on what it is, and people often are against Obamacare until they find out what it actually is and does for people, and then they have a different view of it. And I think that unfortunately we are in a situation where we're doing a lot of correcting of information, and it's a little bit late to be doing that. Unfortunately, it just wasn't sold as well as it should be, and the benefits of it. So doesn't mean we can't do it now, but I think we're just in we're behind the 8 ball, definitely. So, Monica, could you possibly address the question of what does all of this mean for Medicare?
How much time do I have?
You can have 3 minutes.
So, again, we're in a situation where we're not sure. As I mentioned earlier, the Affordable Care Act is over 1,000 pages long. There's multiple federal agencies that are involved in all of this. So when somebody just says, oh, we're going to repeal it, it's not quite that simple. So the Affordable Care Act definitely contained provisions that affect Medicare. Perhaps most significantly, there were provisions to make prescription drugs more affordable for seniors by addressing what's called the donut hole. And it's really unclear, and it hasn't been something that there's been a lot of talk about, at least that I've seen, about what they're going to do with those portions of the Affordable Care Act. Are we going to keep those so that we continue to make prescription drugs more affordable for seniors, or does that get, thrown out with the bathwater as well? So, again, I don't really want to speculate, but I will say that there is some serious potential changes that could occur to Medicare as well if it is a straight repeal.
Great. Thank you. So there's a few questions about why can't cancer patients just get Medicare, like kidney dialysis patients. There's several questions along those lines. And I think that's it's something that's been argued before, that cancer patients should have access to it. I think it's a pretty tough sell right now, but it's definitely something to consider as an argument because, we were talking internally about, some people talk about insurance as, protecting you from the risk of illness. And if you already have an illness, then maybe insurance isn't the best thing for you, and you need something like Medicare. I think that would be an ideal policy. I think it's a really politically tough sell right now, but there's definitely people who are considering that as an option. Another person asked, what about, will the replacement plans address the cost of drugs? And it's not clear whether they will. I think that we've heard President Trump talk about the cost of drugs a number of times and about his intention to try to do something to lower the cost of drugs. But again, it's not clear what that will be and if that will be successful. Congress has pushed back on that in the past. There's a lot of talk of negotiating prices of drugs for Medicare, which would be a step in the direction of lowering the price of drugs, but it's not sufficient. And I think that there are some pharmaceutical companies who are talking about the fact that we really have to, as an industry, address this, and because there's some bad actors out there who make the whole industry look bad. It's really unclear what will happen, but it is clear that the cost of health care is what drives up premiums, not just prescription drugs, but I think often it's the insurance companies that are sort of painted as the bad guy, but they are paying for health care, and the cost of health care has gone up. And it's kind of the entire system, the hospitals, the physicians, the equipment, the medications, they're all expensive, and so insurance covers those costs, and that's why insurance is expensive. So I think that there will definitely be efforts to address that, and there really were, I think the Affordable Care Act included some provisions to address the cost of care, but not as many as were initially proposed, because I think that there was this understanding if we're going to expand coverage, we also have to address costs. That they have, to some degree, addressed costs, but not as well as I think anyone hoped for when it was originally proposed, and it's unclear yet what will be done in this Congress. I told you at the beginning we're not going to have all the answers because we're only 5 days into the new administration and 3 weeks into the new Congress, but we wanted to at least give you some baseline information, and then we will continue to come back to you with additional information as we learn more. So I was talking and not monitoring the questions. Monica, have you seen a question you would like to address? Or I can look.
There's so many. Sorry, I'm still scanning.
Pick one that you would like to address. I'm sorry that we're not getting to all of your questions, by the way. There's a lot of questions. And there's several questions about Minnesota, and I just cannot speak to specifically what happened there. I read a tiny bit about it, but not enough to speak coherently. But what I do know is that a lot of input from a lot of calls to state reps made a difference, and so that just kind of proves that your voice as a constituent is really important. I'm sorry I'm not addressing those questions more adequately than that.
So there is one question about how do we address concerns of people who think that the ACA is a burden on the working taxpayers? And that's definitely something that we hear as we go around the country and educate people about the Affordable Care Act. Again, lots of misconceptions. One thing that I find particularly interesting, especially when we go to the states who have chosen not to expand their Medicaid programs, that argument comes up, this whole idea of, we're working hard, why should we pay for others? But what's been found over the last few years is that in the states that have expanded their Medicaid programs, the cost for health care for everybody has actually decreased, because the more people that are in the pool, the lower the care and the insurance ends up being. So I think that is something that's important to keep reminding people, that it's not really just a tax on working people, but that really having more individuals who are in the pool and more people who have coverage and access to things like preventative services creates a healthier population and also has an economic benefit as well to all of us.
Thank you, Monica. So here's a question for you. Will employers-provided group policies be able to deny coverage to new employees? Are employed cancer survivors trapped in the same job forever?
So that's a wonderful question. So there is actually a federal law that does not allow employer-provided group policies to deny coverage to new employees, and they have to be charged the same amount, but there are some restrictions on all of that, and there has to be some continuous coverage, and we will end up back in a situation that we were in prior to the Affordable Care Act that we refer to as job lock, where a lot of people felt like they couldn't leave their jobs and their employer-sponsored health insurance, because if they did, they probably wouldn't be able to access or purchase health insurance in the individual market. The federal law COBRA is a stopgap measure that allows certain individuals access to continuous coverage for a short period of time, typically around 18 months. But once those 18 months are up, if you don't have a new job, for example, you're still coping with cancer treatment and you can't physically go back to work, what do you do for health insurance then? So while it's not completely impossible if you have an employer-sponsored plan to switch jobs, it does definitely make things a little bit more challenging if you're going to have a longer gap than 18 months.
Great, thank you. I'm looking through the questions. There's one comment. This is not a question, but it's a comment from Nora, who said, I posted my sitter's phone number right by my toothbrush as a reminder to call him every morning to encourage him to save the ACA. Thank you. That's a great idea. Monica, have you seen any other questions you would like to address?
Some great comments.
Yeah.
I did also just want to quickly talk about the Medicare piece, just so that there isn't confusion. For some people who are coping with cancer, they are able to access Medicare after a certain amount of time if they are receiving Social Security disability benefits. So I just didn't want there to be confusion if someone's thinking, hey, I have Medicare and I have cancer. So it is possible once you have been receiving Social Security disability insurance for 24 months to be eligible for Medicare.
So there's
but
a question
certainly that's, sorry.
No, that's all right. Did you want to finish?
I was just going to say certainly that's not a fix to everything because you do have to wait 2 years before you're eligible, but I, again, just wanted to make sure there wasn't confusion in that.
Great. So here's a question from Claire. She says, how much time do people have to make calls and visit town hall meetings? The Republicans and Trump are in Philadelphia now through Friday making decisions and strategizing the repeal and the replacement. Is it not too late now to do all of this? I don't believe it's too late, but I wouldn't wait. We just don't know what they'll come out of. We're definitely going to be very interested to see if they are able to come out of this retreat with a unified plan. And if so, it's still going to take a little bit of time, but it could happen more rapidly. But it's so complicated, I'm just not sure that they are going to come out of that with a unified plan. So I would say it's not too late, but I wouldn't wait till next week to start making calls. I would start doing it now. Yeah, and we don't know when the votes will happen, so it's definitely not too late. But it potentially could move quickly, but it also could drag out, and that's the big unknown here in Washington. Even Lindsay meeting with Republican staff members on the Hill who say they don't know what's going on, and their bosses are on the committees that are really important for this because there's just it's just not clear yet. So I don't think it's too late. Some folks have asked if the webinar is being recorded, and yes, it will be recorded. It is being recorded, and we will post it on our website as soon as we have the link. We have set up a page on our website that's canceradvocacy.org/protectourcare, and we will continue to post updates on the Affordable Care Act to that page, including updating the tip sheet that we mentioned with messaging that will be revised to reflect the current situation. And please feel free to share that with anyone. And if you have stories that you want to share with us about your experience, please do that, because we can take that to your senators and say, this is your constituent who said this. It helps us in our messaging. It helps us when we get calls from the media asking for patients who meet certain criteria that they're looking to write about. So please share your story with us and share it on social media and in letters to the editor and in all of the different channels that we've talked about. Thank you all so much for joining us. I really want to thank Monica and the team at Triage Cancer for your expertise and for helping promote this. And I want to thank all of the team here at NCCS who did a great job pulling this together. And I'm sorry again that we didn't get to all of your questions, but we thank you so much for joining us.
This concludes today's call. Thank you for your participation. You may now disconnect.